Hello there. How are you feeling today? I am truly glad that you are taking a little time to care for your health, and if you are living with diabetes, I want you to know that you are not alone on this journey. Have you ever wondered why you still feel tired, experience numbness in your limbs, or notice your vision getting blurry even though you take your medication regularly and eat carefully? The issue might not lie in how much sugar you are consuming, but in something your body is silently lacking every single day. That is antioxidants. Imagine waking up on a beautiful morning only to find your body so stiff that you cannot get out of bed on your own. You need someone to help you up because your legs are no longer as flexible as they once were. That aching numbness is not just a symptom of diabetes. It can also come from the damage caused by long-term oxidative stress. And what is even more concerning is that nearly 40 older adults will be hospitalized for diabetes complications while you are watching this video. That is a number worth thinking about. So what is the solution? In today's video, I will share with you the 3 most powerful antioxidants that every person with diabetes should know. These antioxidants not only help manage your blood sugar more effectively, but also protect your heart, kidneys, eyes, and nervous system from further damage. If you are dealing with complications like blurry vision, pain in your feet, or simply want to slow down the aging process happening in your body day by day, then this video is truly a gift of health for you. I understand. Living with diabetes is not just about taking medication and dieting. It is the quiet worry every time your blood sugar level spikes unexpectedly. It is the silent fear when your vision blurs or your feet start to lose sensation. And I also understand the helplessness when you are doing everything right, but your health does not seem to improve. That is why, on this journey, I am not only here to provide information, but to walk with you. Together, we will explore what nutritional science has proven to be effective, simple, and suitable for aging bodies. Please stay until the end of the video, because what you are about to learn may completely change the way you see your own health. Do not miss it, because I truly believe that if you understand and choose wisely, your body can heal from within. Antioxidant. Number 1, glutathione. If there is one substance that quietly protects every single cell in your body, helps you fight damage caused by high blood sugar, and reduces complications affecting your nerves, heart, kidneys, and eyes, it is glutathione. Sadly, this is the very antioxidant that most people with diabetes are seriously lacking without even knowing it. Glutathione is an endogenous antioxidant, which means your body can produce it on its own. However, when you have diabetes, especially if your blood sugar levels are frequently high, the amount of glutathione in your bloodstream can drop by 20 to 40% compared to healthy individuals. Some studies by the United States National Institutes of Health have shown that in people with nerve complications, glutathione levels can drop by nearly 36%. This is an alarming figure. Why does this happen? When blood sugar levels are high, your body produces more free radicals. These free radicals are like tiny sparks silently burning through your body's cells, damaging DNA, proteins, and cell membranes. Glutathione works as the main firefighter in your body, responsible for neutralizing these free radicals. When you do not have enough glutathione, your body loses its ability to control oxidative stress. This leads to widespread damage, from nerves to kidneys, from the retinas in your eyes to the blood vessels in your heart. One important note is that glutathione deficiency does not show clear symptoms in the beginning. Many people just feel a little tired, slightly foggy in their minds, and they ignore it. But over time, you may notice prolonged fatigue, irritability, forgetfulness, lack of motivation, and especially a tingling or numb feeling in your hands or feet becoming more noticeable. These are signs of peripheral neuropathy, one of the most common complications in people with diabetes. And glutathione may be the missing piece. It does not stop there. Glutathione also strongly influences reproductive health. In men, low levels of glutathione weaken sperm and make them more vulnerable to oxidative damage. In women, eggs are affected, cycles become irregular, and the ability to conceive decreases. Even sexual desire can diminish, as glutathione impacts hormones, blood circulation, and emotional well-being. Biologically, glutathione is also compared to a key that helps insulin work more effectively. When your body lacks glutathione, your sensitivity to insulin decreases. This means sugar in the blood cannot be efficiently converted into energy. Then you fall into a vicious cycle. High blood sugar increases oxidative stress, which lowers glutathione, leading to more damage. So how can you increase your glutathione levels? The good news is that you can help your body produce more glutathione through food. Sulfur-rich foods are key because glutathione is synthesized from 3 sulfur-containing amino acids: cysteine, glycine, and glutamate. Foods that should be included regularly in your diet include beef liver, eggs, garlic, broccoli, asparagus, spinach, and avocado. For example, 100 grams of beef liver can provide up to 25% of your daily sulfur needs. 3 cloves of fresh garlic add around 15% more. 2 eggs contribute about 8%. Combining these foods helps your body get enough raw materials to make its own glutathione. However, there is an important note. Glutathione is easily destroyed when cooked at high temperatures. Therefore, you should eat vegetables like spinach and asparagus raw or lightly steamed whenever possible. Additionally, pairing with foods rich in vitamin C, such as kiwi, bell peppers, or oranges, helps recycle glutathione more effectively and strengthens your immune defense. In urgent cases where a quick increase is needed, you can consider 2 popular supplements: N-acetylcysteine, NAC, and liposomal glutathione. NAC is a direct precursor that your body uses to make glutathione. A typical dosage ranges from 600 to 1,800 milligrams per day, depending on your health condition. Liposomal glutathione is designed to bypass digestion and absorb more efficiently, usually taken at 250 to 500 milligrams per day. Of course, it is best to consult your doctor or a nutrition specialist before using these supplements long term. Finally, there is something you need to remember. If you are experiencing ongoing fatigue, numbness in your hands and feet, memory loss, reduced sexual desire, or slow wound healing, glutathione might be the missing link. And when you start replenishing it the right way, you are not only relieving symptoms but also preventing dangerous complications in the future. Antioxidant. Number 2. Vitamin E. Among the antioxidants, if glutathione is the quiet protector working inside each cell, then vitamin E is the outer shield that guards your cell membranes from external damage. Unfortunately, many people with diabetes do not have enough vitamin E to form this protective layer. Vitamin E is a fat-soluble antioxidant found in the membranes of cells, especially in sensitive tissues like the heart, kidneys, eyes, and nerves. It helps neutralize free radicals, reduces inflammation, and protects tissues from oxidative damage. When blood sugar levels are high, oxidative processes increase. The body is forced to use more vitamin E to neutralize harmful molecules. As a result, people with diabetes lose vitamin E more quickly than others. In addition, fat absorption disorders, which are common in people with diabetes, make it harder for vitamin E to be absorbed from the intestines. Some medications used to treat cholesterol, blood pressure, or even diabetes itself, like metformin, can also reduce the body's ability to process vitamin E. The signs of vitamin E deficiency are often very subtle. You might not notice anything right away until the small symptoms become more obvious. These may include irritability, low mood, forgetfulness, or even mild depression. Studies have shown that people with vitamin E deficiency have up to a 40% higher risk of anxiety and depression due to damage to brain nerve cells. This is especially important for older adults who are already more vulnerable to hormonal changes and oxidative damage due to age. You may also find it harder to manage your weight. Vitamin E plays a role in helping the body use fat for energy. When you lack it, your body tends to store more fat, especially around the abdomen. In women, this can cause irregular menstrual cycles, lower egg quality, and difficulty conceiving. In men, vitamin E protects sperm from damage. Without it, sperm count and mobility can decrease. Reproductive health is affected, and so is sexual desire due to reduced blood flow and hormone production. When it comes to the nervous system, vitamin E plays a critical role. It helps protect the myelin sheath, the coating around nerve fibers that allows signals to be transmitted efficiently. When vitamin E is deficient, this protective sheath becomes thin and more vulnerable to damage, leading to symptoms such as tingling, burning, or numbness in the hands and feet, symptoms often seen in people with diabetes. A study from Tufts University found that people with low levels of vitamin E have a 50% higher risk of nerve damage compared to those with sufficient levels. Vitamin E also helps reduce inflammation in the kidneys and lowers the risk of damage to the glomeruli, the main filtration units of the body. A deficiency in vitamin E speeds up kidney function decline, especially in people who already show signs of protein in their urine. In the eyes, vitamin E protects the retina from oxidative stress, reducing the risk of cataracts and macular degeneration. As for the cardiovascular system, it softens artery walls, lowers blood pressure, and improves blood circulation, all of which help reduce the risk of stroke and heart attack in people with diabetes. So how can you supplement vitamin E properly? Several foods are rich in vitamin E and can be included in your daily meals. 1 tablespoon of sunflower seeds, about 28 grams, provides around 66% of your daily needs. Almonds provide 48%. Hazelnuts, avocados, and wild-caught salmon are also excellent sources. These foods are not only rich in vitamin E, but also provide healthy fats that improve its absorption. You can try dishes like grilled salmon with avocado and sunflower seed sauce, or an avocado salad with olive oil and baby greens. If you enjoy gourmet meals, roasted lamb with sunflower seeds and saffron is a delicious choice that provides more than 40% of your daily vitamin E intake in a single serving. Keep in mind that vitamin E needs to be consumed with fat for proper absorption. So be sure to pair it with healthy fat sources like olive oil, fatty fish, or nuts. Avoid cooking at high temperatures, as this can destroy up to 30% of the natural vitamin E in food. For those who cannot get enough vitamin E through diet alone, supplements such as D-alpha tocopherol are the best option. This is the natural form of vitamin E, which is easier for the body to absorb. Reputable brands like Solgar and Now Foods offer doses of 400 IU per capsule. Safe supplementation typically ranges from 200 to 800 IU per day. However, if you are taking blood-thinning medication, it is important to consult your doctor to adjust the dosage properly. If you notice that your skin is dry, your eyes feel tired, you are unusually fatigued, or your nerves feel more sensitive than before, your body may be sending you a signal. And vitamin E could be a crucial piece you are missing. Start with the smallest, simplest changes, a handful of nuts, an avocado, or a serving of salmon each week, and let your body begin to heal, little by little. Antioxidant. Number 3, vitamin C. When people think of vitamin C, they often associate it with the common cold or immune support. But few realize that for people living with diabetes, vitamin C plays a far deeper role. It is not just a vitamin that helps you fight off infections. It is also one of the most powerful weapons your body can use to protect blood vessels, nerves, eyesight, and even your heart from the silent damage caused by oxidative stress. What makes vitamin C unique is that your body cannot produce it on its own, nor can it store it for long. That means you need to replenish it daily. But if you have diabetes, the situation becomes more urgent. The reason is this: both glucose and vitamin C use the same transport pathway to enter your cells. When your blood sugar levels are too high, glucose takes over this pathway, blocking vitamin C from entering the cells. As a result, even if you eat a lot of fruits or take supplements, your cells may still not receive enough vitamin C. This kind of deficiency does not reveal itself right away. It starts with small signs. You may feel tired more easily. Wounds may take longer to heal. You may bruise from even light touches. Then come aching joints, dry and dull skin, and a weaker immune system. But the most concerning effect is on your nervous system. Vitamin C plays a crucial role in producing collagen, a vital substance that makes up the protective sheath around your nerves. When there is not enough, this sheath weakens, and your nerves become more vulnerable to damage, especially in your hands and feet, where symptoms like tingling, numbness, or dull pain often appear as diabetic nerve complications. Studies from McMaster University have shown that people with diabetes who are deficient in vitamin C are up to 50% more likely to develop nerve complications compared to those who have sufficient levels. Moreover, vitamin C is involved in insulin metabolism. It helps improve the cell's sensitivity to insulin. This means your body can manage blood sugar more efficiently. Some studies even show that with adequate vitamin C intake, the HbA1c level, which reflects your average blood sugar over 3 months, can drop by 0.5 to 1%. That is a significant enough change to potentially alter a patient's entire treatment plan. Vitamin C does not stop there. It also helps protect your eyesight. It reduces inflammation in the retina, slows down the development of cataracts, and lowers the risk of macular degeneration, all of which are common issues among older adults with diabetes. In your kidneys, vitamin C neutralizes the free radicals that attack kidney cells and helps slow down the progression of chronic kidney disease. In your heart, it helps lower blood pressure, softens blood vessel walls, and prevents the buildup of bad cholesterol. So, which foods are richest in vitamin C? The good news is there are many easy options. Acerola cherries are among the richest sources of vitamin C in the world. Just 100 grams of fresh fruit can provide over 1,600% of your daily needs. Next is camu camu, a fruit native to South America, which provides around 760%. Red bell peppers, kiwi, guava, and strawberries are also excellent sources. A serving of 100 to 150 grams of each can easily exceed 100% of your daily requirement. If you enjoy gourmet dishes, try a ceviche made with guava and passion fruit, or a kiwi and red bell pepper salad with saffron dressing. Not only tasty, but also packed with antioxidants. A smoothie made with acerola cherries, camu camu, and a few mint leaves is also a fantastic way to start your day feeling energized and refreshed. However, vitamin C is sensitive to heat. It breaks down easily when exposed to high temperatures, so it is best to eat it raw or lightly steamed. Boiling or frying at high temperatures can destroy more than 50% of the vitamin C in food. A small tip to improve absorption is to pair vitamin C with healthy fats like avocado, olive oil, or nuts. You can also combine it with iron-rich foods like dark leafy greens or red meat, which enhances iron absorption. This helps your cells breathe better and reduces fatigue. If you need to supplement with capsules, consider using liposomal vitamin C, an advanced form that improves absorption into the bloodstream. A common daily dose is between 1,000 and 2,000 milligrams. Brands like Live On Labs or Pure Synergy are highly recommended by health professionals. But if you have kidney stones or are taking blood thinners, be cautious, because high doses over a long period may cause side effects if not properly monitored. Vitamin C is not a cure-all, but for people with diabetes, it is an essential link in protecting your body from silent damage. One kiwi in the morning, a few slices of bell pepper at lunch, or a glass of fresh orange juice in the afternoon. These small actions may be the first steps toward keeping your vision clear, your legs flexible, and your heart strong. Dear friend, if you have made it this far, I truly believe that you care deeply about your health, and that is something to be proud of. Because living with diabetes is not just about taking medication or following a strict diet, it is a lifelong journey of protecting yourself day by day. Together we have explored 3 incredibly powerful antioxidants. Glutathione, the silent hero inside every cell that helps detoxify, restore, and protect the body from harm. Vitamin E, the shield that surrounds your cells, supporting your heart, nervous system, and even reproductive health. Vitamin C, the torch that lights up your immune system, reduces inflammation, protects your eyes and kidneys, and boosts the effectiveness of insulin. You might be thinking that all of this sounds overwhelming or complicated, but the truth is the path to better health does not have to start with something big. All it takes is one small change: adding more greens to your plate, eating a few sunflower seeds, choosing a kiwi instead of a pastry, or simply drinking a glass of fresh orange juice each morning. These little choices, when repeated daily, are what truly lead to lasting results. If you are feeling tired today, worn down, or worried about the complications that may arise, please do not give up. Your body is still listening, and it still has the power to heal. Even the smallest action you take today is a reflection of the care and love you have for yourself. Keep going on this journey. Choose what is best for your body, your mind, and your life. If you found today's information helpful, please do not forget to like this video and subscribe to the channel so you do not miss any future updates. We will continue to walk with you, bringing even more valuable insights to support your health. And what about you? Are you already using any of the vitamins we talked about today? Have you noticed any changes from the small adjustments you have made? Please leave a comment below and share your story with me. I am always here, ready to listen to your journey. Wishing you strength, peace, and steady control over your health. See you again in the next video.